Hello everyone, this is Pavithra, Pediatric physiotherapist at Healthqrehab. In this video, we will be discussing about tips to manage feeding problems in children with cerebral palsy. Feeding is one of the major tasks and an important task for the parents and the caregivers, and feeding is also an essential part for the children so that they learn self-eating skills in future. So today in this video, we will be discussing some of the tips to manage these problems for children with cerebral palsy. Number 1, select correct consistency and also texture of the food which is age appropriate for the child. For example, if the child is 6 months old, select semi-solid for the child to feed. So rather than giving liquids. And if the child is 1.5 years, do not start the child with semi-solid. Introduce solids for the child. So the food introduction should be age appropriate for the child. Number 2, give adequate time for the child to chew and swallow. Whenever you are feeding the child, place the spoon at the lower lip level so that the child will have a good control of gulping the food to the mouth. Introduce sips of water to the child whenever the child is eating. And also introduce messy eating for the child. So this messy eating will help the child to build awareness in his sensory systems, and also he will learn self-eating skills. Positioning. Ensure your child is seated comfortably while eating. Use of cushions, high seating chairs, adaptive seatings will help the child to sit comfortably while eating. Adaptive devices. Depending upon the severity of the child, use of straws, cups, assistive plates will help the child to learn self-eating skills, and also it will help the caregivers to have an assisted feeding. Feeding techniques. Learn effective and feeding techniques from the therapist, as it is important to know the breath-swallow rhythm for the parents. So while the child is chewing, do not give the child water immediately. Let the child chew, swallow, then give a sip of water for the child. So for this, you can consult a speech therapist or a pediatric physiotherapist to know the feeding techniques. Variety foods. Offer a variety of foods for the child so that the child will explore new tastes and also textures of the food, and also he develops sensory awareness of its oromotor structures. Swallowing and aspiration. Make sure that the child is sitting comfortably upright and never make the child lie down and eat. Make sure his trunk is erect so that the aspiration issues will be reduced. Addressing hyposensitivity and hypersensitivity. Some children with cerebral palsy will have oral aversiveness or sensitivities for different textures or different touch. So make sure you visit a speech therapist or a pediatric physiotherapist to have a detailed assessment on his sensitivities of his oral motor structures. Patience and encouragement. As a caregiver or a parent, you must be patient and encourage the child to have a different variety of foods so that the child will explore different types of food, and also he will get aware about the food that he is eating. And later on, he will also learn self-eating skills. So these are some of the tips for managing feeding problems in children with cerebral palsy. Hope you found this video helpful. For further information, log in to www.healthqrehab.com. Thank you.